Disorders of consciousness and the level of consciousness dial. Alterations of the level of consciousness are very common in clinical practice. To help understand and explain them, I will use a new tool, the level of consciousness dial. This graphic dial may also help explain to patients and family the clinical condition of the patient with altered level of consciousness. Consciousness is a spectrum, a continuum, which also varies during the day even in normal people. In the hospital environment, the variations and fluctuations of the level of consciousness demonstrate a much wider, and sometimes dramatic manifestations.
For purposes of this explanation, we are going to use a dial similar as the speedometer in a car. The quote-unquote normal speed of consciousness may represent the average speed of traffic in the freeway. At the extreme right, consciousness is higher than normal, as could be seen in cocaine or amphetamine use, hyperkinetic delirium, mania, for example.
But for purposes of this presentation we are concerned about speeds less than normal. The first one on the left of normal on the diagram is the minimally conscious state, followed by the vegetative state, later coma, and lastly brain death. For more on brain death, see the description below for the link to the brain death video.
Several clinical tools that measure the level of consciousness. One of the most common and known is the Glasgow Coma scale. The GCS has 3 components, mainly the eyes, the verbal and the motor. The eye component has a total of 4 points with a range from 1 to 4. The verbal component has a total of 5 points with a range of 1 to 5. And the motor component has a total of 6 points with a range of 1 to 6. The maximum number of points is 15 for a patient that is awake, aware, interactive. The minimum number of points is 3, which would represent deep coma. In general, coma is defined as age of 8 or less points.
Anatomically speaking, the level of consciousness depends on the relative integrity of both cerebral hemispheres and also the brainstem, in particular the upper brainstem, which contains the ascending reticular activating substance, which drives the function of the hemispheres. So, when you hear saying the patient has a GCS of 15, then you just heard that both cerebral hemispheres and the upper brainstem are working.
The level of consciousness is a spectrum, which fluctuates, sometimes from minute to minute or from hour to hour, depending on the injury or damage, time of the day, medications, etc. If from the normal levelsness, the function begins to decrease, the next slower step is the minimally conscious state.
The minimally conscious state is a state of severely impaired consciousness, whereby the patient presents with marginal but explicit behaviors, thus demonstrating some evidence of self or environmental awareness. Essentially the patient has partial consciousness. They may have periods where they can communicate or respond to commands, such as moving a finger when asked, may localize, and look around. A person may enter a minimally conscious state after being in a coma or vegetative state.
In the vegetative state, which is different than persistent vegetative state, there is absence of responsiveness and awareness with preserved autonomic and motor reflexes and sleep-wake cycles. Patients may have complex reflexes, including eye movements, yawning, and involuntary movements to noxious stimuli, not following commands or trying to communicate, but show no awareness of self or environment. May appear awake. They may have reflexive emotions. The patient has automatic functions that may include sleep-wake cycles. Persistent vegetative means that the patient has been in that state for 8 to 12 or more weeks.
In coma, the patient is unresponsive, and the patient cannot be aroused, and the eyes remain closed. The patient does not follow commands, does not interact. Coma is generally defined as GCS of 8 or less.
Of course, there are other alterations, differential diagnosis and components within the spectrum of the level of consciousness, which include stupor, catatonia, akinetic mutism, psychogenic responsiveness, among others.
One important differential diagnosis is the locked-in state, where the patient is unable to move the body, with the exception of the eyes, at times only partially, yet the patient is fully awake, aware and alert. Since they cannot control their breathing nor protect their airway, they require intubation of the airway. It is important to open the eyes of the patient, and ask them to look to the right, left, up and down, and see if they can follow those commands.
This concludes the overview of disorders of consciousness using the consciousness dial tool. Please see the description for the disclaimer and bibliography. Thank you.